So we were talking a little bit earlier about my grandma and her denture issues, and I was doing a little research online and saw something about all-on-4 dentures. Can you tell me a little bit about that?
So all-on-4 is a concept that started quite a while ago, and basically it's a way for a person to replace all of their teeth with 4 implants on each arch. There are 2 ways to do all-on-4, and sometimes all-on-4 is a misnomer, sometimes it's all-on-6. It just depends on the case and what it takes. So the all-on-4 or all-on-6 is how many implants are supporting the teeth.
Okay.
Yeah. Okay. So you can have 2 types of dentures that are all-on-4 or all-on-6. One is a denture that is permanently fixed in the mouth. It's actually you don't take it in or out to clean it. And the other is one where you can take the denture out of your mouth and clean it. So the difference between those 2 is there is one is implant retained, meaning that it's actually screwed to the implants, and the other is it's implant supported, which means that the implants are holding the denture in place and supporting it. So Amelia, this is what I was talking about. All-on-4 is most commonly done on the lower arch, and you can see where each one of these little screws are.
Mm-hmm.
That is where an implant is, and if you look through the model you can actually see the 4 implants in place. So with an all-on-4, in this case, this is an all-on-4 where the patient can remove the denture and clean it and clean around the implants. So this is an implant-supported denture. All right. So what happens is then the denture snaps onto place. It's just like having your natural teeth back again. You get all of your chewing power back. No worries about dislodgement or anything. Try and take that off. You can see how well that holds on there.
Oh, wow. Now, would she also be able to use her normal dentures for this, or would she have to get new ones made?
She would have to have new dentures made for that. So you can see it sticks on
It's
there
not
pretty
going anywhere.
darn good. Yeah. The other common type of all-on-4 device is where we'd still have these 4 implants, but instead of this metal being attached directly to the implants, that metal framework is actually embedded inside of the denture. And then we make a little hole in the denture wherever one of these screws are. So then the denture would go to place, and then there would be little access holes. There would be 4 holes here that we would cover up, but then the screws go into each of those holes. So that's just like having your teeth back. One of the benefits of the screw retained one is you do not have to have all of this pink plastic in your mouth. Okay. You can just have the teeth themselves, and you clean those simply by just flossing underneath them. So there's 2 types of all-on-4s. There's either the bar is attached to the implant and the denture snaps onto it, or the bar is inside of the denture and the denture screws down onto it.
Okay.
Alright. So we'd love to see your grandmother sometime and see if she'd be a candidate for this treatment.
I'll sure bring her in for it.
All right.